So can I get a show of hands for anybody who's ever been excited about the birth of a child? Ever? Ever? Yeah. So I want you to contrast that with the pain that 15% of US couples feel when they discover that they have trouble getting pregnant or have infertility. As the medical director at the University of Michigan Center for Reproductive Medicine, I'm Michael Lanham, and I have the privilege of working with the subset of 15% of couples who have this problem every single day. When they come to my clinic and they say, what's my best chance for getting pregnant? The answer is there's a treatment called in vitro fertilization. And they ask, well, what does that really mean? That's what this means. It's a huge amount of medication to try to track over time. It's very expensive. It's often not covered by insurance. And even with really high stakes and truly compliant patients, it only works about 33% of the time. This is about $25,000 per treatment. And when we ask patients, they have to do things at the exact right time every day, and they cannot run out of medications. These medications aren't easy to get. They're often mail order medications. 15% of patients will report some sort of medication error, and a full 3% of patients will report a medication error that actually scraps the entire cycle, and they truly can't try to get pregnant this month. To try to avoid that problem that they somewhat know about, they actually overbuy medication. So 100% of patients are over-purchasing expensive medications that they don't end up using. Welcome to OnTrack. OnTrack helps put the control back in patients' lives. It's introduced to the patient in the physician's office and allows them to then link with the physician's office for the information we would be presenting to them anyway, but in a digital form. They can then have medication reminders so they don't forget to use their medications on that day. It integrates with the information the provider gives them on what they're supposed to pick up from the pharmacy so that they know when they're getting it that they have enough. And behind the scenes, it's using mathematical modeling from data we have at University of Michigan to predict how many more days of treatment you're going to have so that you can try to get down from an average of 3 days of extra medication to an average of 1 day of medication, which is a savings of somewhere between $1,100 and $2,600 per patient. The competition is weak in this. There's very little patient-provider interaction. It doesn't really account for the rigid schedules of fertility flows, and there are other applications that aren't really specifically for fertility treatment cycles. And the market is increasing. In vitro fertilization cycles have doubled in the number of births over the last 15 years and will continue to grow over time, especially as the reproductive age women are getting older. What's success for OnTrack? The biggest success is putting the client back in control, having a perfect fertility experience and saving thousands of dollars in the process. Our next step is to create this application and to perform a randomized control trial at the University of Michigan with patients that are through my clinic so that we can show this difference, show improved patient outcomes, and show that we can get rid of that 3% who scrap their cycle entirely by helping them support them through the service and really keeping them on track. Thank you.
Thank you very much. Preston?
I have a couple questions. One, how do you monetize this, and what's the size of the market? When you say 15%, once you say how you can monetize it, like what does that mean from a revenue potential?
So we do 176,000 cycles annually a year, and so it's a $3.2 billion market that people are spending already. And they spend it on things like just extra books or acupuncture, things that aren't proven. The way that fertility medication works, people either have coverage or they don't. And so they're more likely to buy it from the expensive place if they have coverage because they don't care. And so it depends on the type of patient. But in total on the screen you can see it's about $275 million annually that patients would save. And then by charging either the insurer or the patient, depending on how they're covered for this, it would potentially bring in over the next 5 years up to $10 million in the 5th year.
What are some of the downfalls from some of the other companies that are currently out there?
So they truly just don't have the goal of minimizing this cost expenditure for the patient. They don't do the medication tracking. They don't really walk the patient through the process, which is what patients really want. They want to feel like they're in control. From a monetary perspective, allowing us to put them more in control of the medication is the focus of the back end of this right now. And they just don't do that.
Time for one more question?
Yeah.
So how uniform is this to patients? I mean, is it sort of, it's the same formula for every patient, or are there variances in what, different patients' schedules?
Right. So there are variances, but each day the clinic has to communicate the variances to the patient anyway. So there would be partnership. I would use my ties throughout the country with different fertility physicians to help prove that this is actually going to decrease their nursing time with explaining these things, decreasing the frantic phone calls at 9 p.m. that I don't have my medication, and add value to the physician as well. But the software would then be able to handle all the different variations that come through. It's very complex to a patient because kind of comes down to several yes or no's throughout the process.
Okay, I have one quick question.
So what's going to be a measure of success after the clinical trial? What improvement will you attribute to the
So we want to get rid of that 3% entirely that totally scrap their cycle. So we'd like to see an improvement in the number of people who have any kind of medication error. And we would like to see a decreased level of stress. We'll actually just measure that with some validated trials, and then we'll be able to show the difference in the medication expenditure that patients are having over time.
Thank you very much.